You are fine. All right, can we get started? All right, let me just say, is it good after? Is it afternoon or morning? It's afternoon. Let me say good afternoon to everyone. This is our second Saturday at Minute Maid. And look, this is we are trying to provide vaccine shots to as many as possible. I want to start off by just thanking again Director Steve Williams and his staff. Please give it up to them. Again, they have done a yeoman's job. Last week, you know, when we set up this mega site last Saturday, they provided vaccines to 3,852, and that exceeded our expectations. And today the city's health department will be vaccinating 5,000 people today. It will be 5,000. All of those slots have already been filled. People have been notified. People are coming in. But we will do 5,000. That's our capacity for today, and we'll get it done. And I want to thank Director Williams and the incident commander, Sally, for making it happen. And you'll be hearing from Sally a little bit, but give her a hand because they have done an outstanding job. I believe up to this point, I think we've already done more than 2,200 up to this point, and that number is growing. There are a number of stations. They're trying to change the arrangement this time. Instead of there being 3 parts on 2 different levels, placed everyone on that first level. And if you notice today, a number of people from the disability community are coming through. So they are really doing an outstanding job at reaching out to make sure that our critical population are attended to. From all indications, I think most people are very satisfied for what's taking place today, and that from all indications, I think most people recognize that things are operating smoothly. But when you are trying to provide vaccines on such a large scale, it requires a lot of logistics, as Dr. Percy would say, a lot of heavy lifting, but we are getting it done. The job is to get these vaccines out as soon as possible so that they are not sitting on shelves, and I can assure you they are not sitting on shelves. So it's a heavy lift. It's a large operation, and you may have glitches every now and then, but on balance, there's a huge demand for these vaccines. And let me remind people of how the process works. You know, we get an allotment. You know, the feds will send an allotment down to the state, then the state will make that allotment available to the cities and the counties, the local providers, and so you know, we don't quite know what we're going to get or when we're going to get it. And then when we get the allotment, we try to make it available. So let's just like this week, midweek, we got an allotment of a little more than 8,000. And then that enabled us to expand what we were planning to do here at Minute Maid. And so we increased, as you know, yesterday we opened the slots up, 2,600 additional slots based on what we got midweek. In 16 minutes, those 2,600 slots, Congresswoman, were gone in 26 minutes, but that enabled us to go up to 5,000. But there is still a huge demand that's out there, and people want to get their vaccine shot. They want to get it now. Hundreds of thousands want to get it now, but we simply don't have the means to provide everyone those vaccine shots right now. So we are doing the very best we can with what we have, and I am very, very pleased with the number of people that will be coming in today. And then, of course, we'll continue to provide vaccines during the week, and we'll be able to do more and provide more outlets based on the shipment, the allotments that we receive. So I'm just asking people to be very patient with us in the process. We also want to make sure that we're providing some community outreach as much as possible. So there are some other clinics that are available. La Nueva Casa de Amigos is one. Sunnyside is another. Sharptown is another. Those are community clinics. And then it's our hope that next week we can also extend this even further to some areas in the Southwest Houston. I know Dr. Kathy Flanagan and Shannon Buggs with the Health Equity Response Task Force are working on some additional things for community outreach. So we want to kind of get it out into the communities. It's equity in distribution, and so we want to make sure that as best we can, that we are making sure that no particular group at-risk population is left out. So I want to thank them for what they are doing. I want to thank the volunteers from the Houston Livestock Show and Rodeo. Please give it up to them. I want to thank them. I mean, they are just tremendous. The hospitality, their personalities, I mean, just been terrific. So I want to thank them. I want to thank our EMS, Houston firefighters, for what they are doing. Please give it up to them. And then when you're bringing in 5,000 to one location, I want to thank the Houston Police Department, our police officers, law enforcement, for what they're doing on traffic management. Want to thank them. And then we've got some private individuals, vendors, who are assisting because there are a number of stations. The goal is to try to get 400 to 500 people through here every single hour. And so it requires a number of different stations, so I want to thank them. And then lastly, before I yield, first to Director Williams, and that is, bear in mind that we are still in the midst of a lot of community spread in this city, in this community. This virus has not gone away. In fact, this virus is spreading. So the positivity rate is still much, much higher than any of us like. There are still too many admissions. You know, the number of people going to our hospitals is increasing. The number of people in our ICUs, that number is increasing. So we have to work together to bring this community spread down. I am still getting some disturbing pictures, for example, of people that are hanging out, Dr. Purse, in these clubs that have been recharacterized as restaurants. And let me tell you, they are not restaurants. So I'm calling on the TABC to crack down and to rescind some of these reclassifications. I talked to Chief Pena again this morning based on some pictures that I received. And so they are going to be at some of these restaurants tonight, kind of looking at them. But as Chief Pena said, Mayor, it is ludicrous when these bars and clubs have been allowed to classify themselves as restaurants. And when you look at these pictures, there's no food on the table. None, okay? That is crazy. I'm calling on the state to review their policies. They have to review their policies. That is a huge loophole. And it makes it difficult for us to do anything with. When the TABC has allowed these restaurants, these clubs, to operate as restaurants, and they are not. They are community spreaders. They are community spreaders, and they're working against what we are trying to achieve. So Chief Pena and some of his folks will be out there later on this evening, but again, too many loopholes that have been allowed. Makes it very difficult. So bear that in mind. Please govern yourselves accordingly. Watch your behavior. That's important. Now let me bring on Director Williams, and then we'll go from there. Director Williams. Oh, you brought me something.
Yeah, I thought you wanted to do the statistics.
Oh.
You can't see.
Well, let me just say, based on preliminary data on about half of the total doses administered as of this morning by the Houston Health Department, 52% have been male, 47% have been female, 41% have been white, 22% have been Hispanic or Latino, 19% have been black, 16% have been Asian in that number. So there's some widespread distribution. That demographically, it's all spread out throughout our city, which reflects the diversity of our city. So that's what's as of this moment. Those are the percentages that we have. And so I want to thank the Health Department again for this heavy lift, for working to provide 5,000 vaccines today. but also making sure that we have an equitable distribution as well. So I can't say enough for this health department. I'm very, very proud of them. That's why, you know, we just don't have an argument at all. We just never disagree. You know, we're just on the same page, and that's because, you know, I simply do what Director Williams tells me to do, and I'm so proud of being able to follow instructions. Let me bring up Director Williams.
Well, thank you, Mayor. Y'all know he wasn't really being exact or telling the truth when he said that we don't argue. The reality of it is that I got a directive about 2 nights ago between 8:30 and 9 o'clock to do 5,000 in Minute Maid Park. Although I said, Mayor, you know, if we do 5,000, that means we're not going to have enough for the next week. But he insisted that we get out as much vaccine as we could. And so, therefore, I called my staff and said, y'all, he told me to do 5,000, but if you do 4, I think I can calm him down. So I'm told that Solly and a number of other folks were talking as late as 12 o'clock that night, figuring out how we can do 5,000. So, Mayor, they really did take your directive very seriously. I'm really proud that we were able to bring all of these partnerships together in order to make this thing happen today. Want to really give a shout out to Marcel with the Astros Foundation, because this layout that you see is a result of him going back and seeing what our process looked like last week and actually designing this as a result of looking at films and also talking to the staff as to how we wanted it. So I'm grateful for my staff for being willing to listen to somebody that wasn't inside our organization and really taking their advice to really smooth this process out. Grateful to the police department. I can't tell you how grateful I am, because they do a really good job of working with us, not only outside, that is very evident, but very much inside. And you can see that being evidenced when you see the officers that are walking around here. To date, as of January the 15th, we have received 30,350 doses of vaccine. As of January the 15th, we've administered 21,025 doses. Of course, here at Minute Maid, at our Bayou Center Event Center, at our Northside Clinic, at La Nueva Casa de Amigos Clinic, at our Sharpstown Clinic, Sunnyside Health Centers, JWPV Senior Center, and Acres Home Multi-Service Center, and Hiram Clark and Magnolia Multi-Service Centers. The reason that I pointed those other locations out is because all of those locations are directly in the neighborhoods that we want to serve. Next week, we're going to be expanding that footprint into at least 2 Walgreens that are in high positivity zip codes. And we are on track today to see 5,000 folks. In addition to what we've already done, we've also helped our partners out. We've transferred 1,900 doses to partners who are in need of vaccine because they had people that are working in line. I'm grateful to have the team in the health department that's willing to follow my direction and willing to really stretch to make sure that we are of service to this community, because we are in fact public servants. We take pride in that. We will continue to protect the H. Sally Diaz is today's incident commander. She's actually one of our assistant directors that is in charge of all of our multi-service centers and our health clinics. We really wanted to really make this a part of our operations, and so we asked her to step in with assistance from a lot of other people to help us pull this together. Sally?
Thank you. This has indeed been a big undertaking, but it has been through the efforts and the work of so many different partners, not only the ones that they have mentioned, but even MetroLift, who is picking up from parking lots A and B to bring folks here. So we are on target to see the 5,000 patients who have appointments. Obviously, those that are coming in do come in with a unique identifier so that we know that that is who is scheduled to receive the vaccine. We try to process them just as quickly as possible, get them into the facility, ensure that all the paperwork is done, that there's no contraindications to receive the vaccine, and then at which point then we go ahead and vaccinate and get them on out. Again, this has been the work of all the partners that were mentioned. That's obviously a collaborative effort, but we're very pleased with the outcome. We did change the layout, as Director Williams mentioned. We felt that this was a much smoother operation, so it just streamlined the entire process, so people are coming in one way, getting processed, and then out a different route. So there's one entry point and one entry point. That also helps us with managing disease containment and also streamlining the process. So we're very pleased with what we have seen today, and we hope to just continue to make an impact, because we know that the hard work that we're doing now is paying off in dividends, because this is what's going to help us get over this pandemic. And so we're very delighted to see the demand, and so of course we're going to meet it as best as we can based on vaccine availability. It is very much contingent on that. So the more vaccine we're able to do, the more we're able to vaccinate, and then together, collectively, we'll start putting a dent into this pandemic. So I'd like to just say a couple words in Spanish, if I may. Le queremos dar gracias a las personas que han venido a vacunarse, porque sabemos que cuando la gente toma esa oportunidad de vacunarse, va a ayudar a la comunidad entera para bajar esta pandemia, para que ojalá ya pronto podamos regresar a alguna normalidad de lo que tenemos y lo que extrañamos. Así que les queremos dar las gracias a los que han hecho la cita para recibir su vacuna. So we're very happy at the outcomes, and it's our pleasure to serve and get this accomplished.
Thanks, Sally. I do want to acknowledge the Astros Foundation, because they've just been an incredible partner opening up Minute Maid facility. So to Jim Crane, to his entire staff, his entire team, I want to thank them. I also want to acknowledge Metro Lift. As you can see, that they are vital to this operation today. They're bringing in many of our people in our disability community to make sure that they have the ability to get here. And so I want to thank Metro. Congresswoman, if you don't mind, let me bring up Dr. Peirce, and then we'll bring up Congresswoman Sheila Jackson-Lee. Dr. Peirce.
Thank you, Mayor, and I'll be brief, but really a big thank you to the Health Department team for all of the incredible work that they've done bringing this together. Thank you to the media for getting the word out. Thank you to the public for coming. We are not out of this yet. The hospitals are full, and for us to do this today, we had to have a lot of volunteers come from Rodeo Houston. These are medically trained people. They volunteered their time. These are the nurses, paramedics, physicians, and folks. Many of them are the ones that are working in the hospitals that are overcrowded right now, and on their precious free time they came. So really a big thank you to them. And one other thing along those lines, if there are any nurses out there that are looking for work, all of the hospital systems are hiring right now. There are our hospital occupancy capacity is not limited by the number of physical beds. It's limited by the number of nurses that we have working. So if there are any nurses out there that are looking for work, check with any of the major hospital systems. They're all hiring right now, and hopefully we'll avert any problems there. But the efforts of today will, in just a few weeks, as immunity starts to rise in the community, which in the beginning, let's keep in mind, it'll be very, very tiny compared to the whole population, is going to make a dent. So today's effort is the beginning of the light at the end of the tunnel. We've got a long way to go, but as a community, we have done so much already. We've done it before, and I know in my heart we're going to keep our foot on the brake of the virus and our foot on the gas for getting the solutions with the vaccinations out, and just really proud to be part of it.
Look, this next person, in addition to being a congressperson, a very dear friend, and I want to, and bringing her up, I know this has been just an incredible week in Washington, D.C., with our representatives in D.C. I just want her to know how much we appreciate her leadership, her courage, her willingness to stand in the seat of democracy in D.C., and to make tough decisions, but the right decisions. And as they say, it's never a bad time to do the right thing. So really want the Congresswoman to know how much we appreciate her leadership, what she does, not only for the 18th Congressional District, but what she's doing across our country, and the positive impression that it is making. Let me encourage her to continue to go back to D.C. We want her to know that we have her back here, and at the same time we'll have her back in D.C. as well. So it's my pleasure And oftentimes we take things and people for granted until you recognize a week like we had last week, and you realize you can't take anybody for granted and their service and their dedication and commitment, none other than Congresswoman Sheila Jackson Lee.
Thank you very much. Mayor, let me thank you for giving me the opportunity to be able to come home and look at an operation that really should be the premise of all that we're talking about in Washington, D.C. So if any of you wonder why I am here, it is that there are districts and states around the nation that have not even begun to have a structure of vaccinating, and the reason is because under this present administration, nothing is there. So let me first of all join Dr. Peirce by congratulating and thanking Mayor, all of those who are coming. You allowed me to walk around and to see just the throngs of people everywhere waiting patiently, all of the volunteers, the Astro Foundation, but I understand the Houston Livestock Show volunteers, other volunteers, and of course, the most ablest of health departments in the nation, and that is the City of Houston Health Department, under the direction of Dr., which I always call him, Director Williams. I take a little credit for this health department, Mayor, because when I was on City Council, there was an attempt to merge this health department with the county. And I think I was the lone member that said, this is too good a health department. They are good health departments with different responsibilities. Let us work together. So let me congratulate them. Dr. Peirce, thank you for being astute in the medical aspect of it. I want to just start by saying, keep wearing your masks. Keep wearing your masks. And many of you know I spend a lot of time testing and opening up sites. Keep getting tested. That all of that merges together to ensure that we can continue to bring down the community spread, because I'm glad to see the wide diversity, but the numbers still say that Hispanics and African Americans are more likely to get COVID-19, they're more likely to get hospitalized, and unfortunately, they're more likely to die. And so many of you have had friends and relatives and others, and so it is not over yet. But what I will say to you is that we do have a very important light at the end of the tunnel. I want to indicate that we have just introduced H.R. 330. I've been talking about it over and over again. That is to nationalize the distribution and to work with state and local governments. My effort is to make sure that the City of Houston can directly receive their vaccinations to them based upon their plan of vaccination. City of New York, City of Los Angeles, City of Jackson, Mississippi, City of Miami. And so this legislation, which I'm very glad that has been supported by Lieutenant Colonel Anthony Brown, who actually came here, Mayor, during Hurricane Harvey. He's a member of Congress. His knowledge of the military is very helpful. And so we intend to establish a lead effort, if you will, with FEMA engaged in making sure that they can push out additional support services as we push out more vaccinations. We'll develop and deploy a fully staffed and resourced 24/7 advanced real-time tracking system that allows FEMA to know where every vaccine delivery is, so that you can find out, is yours coming tomorrow morning at 9 a.m. and you're not standing and waiting. Though I do appreciate the work that's been done by the state and the advisory committee, I do believe that we can streamline it to get it to where it needs to go. Communication system, an app system for the public health services, doctors' offices, and others to be provided to patients to communicate information on the vaccine being received. And of course, moving the transportation clearly, being able to have the amount of vaccine that you need and have the capacity and competence to restrict the unfortunate use of vaccines. Finally, this legislation complements the Biden announcement that you've heard over the last 2 days. He will be putting forward, and we've got to help him do it, $20 billion in the first 100 days to be able to get vaccines out to the nation. $20 billion that he will utilize and complement with a federally organized distribution system so that we can get these as quickly as possible. In addition, we're looking to give the $1,400 to make it $2,000, and I've had everybody ask me about that. We're trying to move that as quickly as possible, but that is going to require some quick legislation and signing by President Biden to give you the extra $1,400 to match the $600, because I know so many people need help financially, and part of the money will go to the cities in their COVID-19 packages so they can help those who are facing eviction. We still have an eviction moratorium now, and give the cities money that they can do work that is so very important. My idea of fighting COVID-19 is that we do it collaboratively, that we not only do the mega centers, the mayor and I have spoken about that, and I think we agree, but we do these local neighborhood centers as well to make sure that elderly people or people that just are stuck at their neighborhood or not technologically sophisticated can get to be vaccinated. One, I'm glad that we see the enthusiasm. There may be still some who are not quite there, but I want them to hear our voices. We have taken that vaccine because we've been required to take that vaccine. We're walking around. We want to make sure that you get that vaccine, because that is how we save lives and how we get the massive immunization levels that will keep us safe. I've begun to call COVID Uncle COVID. Uncle COVID. And Uncle COVID is a great uncle, but he comes and stays too long. And sometimes you've got to open the door for Uncle COVID, thanking him so much for him coming and visit, but we ask you please to take leave. We got to get Uncle COVID to be on his way. And the only way we can do it is listen to all of these health professionals, listen to scientists, listen to the doctors and nurses, and be able to do things at once. Wash your hands, be able to wear a mask, socially distance, as much as we love doing this, and get in line to get vaccine. Vaccinations are coming. There's a new day coming. $20 billion is going to come. You're going to get a new crunch of money to help you survive. And this bill, H.R. 330, is going to be utilized and moved and pushed along with Biden's effort to make this a reality. I want to close by thanking the United States military. I know that you've utilized the National Guard in times past. You've utilized military nurses in times past. And over this last week, besides the Congress being the seat of democracy, the Capitol being a citadel of democracy, and I truly believe it, and we truly are going to survive this, and we're truly going to a great side of America, which is a bright and better day. But thank them so very much for the work they're doing here in Houston that I've seen them do in Texas, and thank them for the work they're doing in Washington, D.C. as we return back for the swearing in of the next president and vice president of the United States. So, Mayor, thank you for your kindness of yielding to me for this moment, and we look forward to really getting you on the roll. You're on the roll now. We're looking to get you on the roll so you can do as many of these sites as your mind and heart desires. 1 million doses in Texas. We have a long way to go, but we're on the roll. Thank you, Mayor, very much.
I want to thank the Congresswoman for her undying support. Something I forgot to mention earlier today is that when we realized that we had a big challenge in front of us, we had our friends from police reach out to HCA, and today they were willing to provide us with more than a half dozen nurses so that we could speed this process along. So I really want to give a big shout out to HCA for coming to the rescue here this morning.
Okay, thank all of you. We'll take any questions that anyone may have.
Hi, Mayor. Thank you. I know, I've been hearing, like you have been hearing, that most people have had very positive outcomes here. But it sounds like some people have gotten kind of hung up in the logistical, hiccups, the long parking lines, waiting for a while in the stands. What is your? Can you not hear me?
Say it again, Dylan.
I was saying a lot of people have had very positive outcomes here, but I know, a few have had sort of negative experiences with the long parking lines or waiting a while in the stands. What is your message to those folks, and are you guys ironing those things out as you go?
It's going to require some patience. It's going to require patience. You know, we understand that people want to, they want to be able to go online or make a call and get an appointment right then and there. But you have to bear in mind that the demand far exceeds the supply. And you can open it up and you can take registration, and we could have literally 200,000 people registered, but their appointment would be way down in April and May. And then people would be upset with that. And so it does require, when the demand far exceeds the supply, and when the city doesn't control the supply or the timing, it's going to require people to be very patient. And then when the goal is to get these vaccines out as quickly as possible and not to leave them on the shelves, and to set up like a mega site, like today, 5,000. 5,000 people are not going to come in at one time and get their vaccinations and be out of here in 2 hours. Okay, so it takes time. That's why it's pre-enrollment. That's why we try to give the appointments. But this is a heavy lift operation. To do 5,000 in one day, I don't think anybody in the city of Houston, including the hospitals, have done 5,000 in one day. The setup in NRG, that wasn't 5,000 in one day. So in terms of what the health department is doing with our partners, I have said we're going to get these vaccines out. We want to get them out as quickly as possible. In so doing, when the 5,000 people are coming through in one day, and you're looking at about 400 people coming in per hour, in some cases, maybe a little bit more, you know, it's going to require a great deal of patience. But what I will say, for the 5,000 who are getting their vaccines today, there are hundreds of thousands that wish they could be in the seats of those 5,000, okay? So, I mean, think about that. You're getting your vaccine today, you are here, the vaccine is going to be given, but there are literally hundreds of thousands of people, no, back up, millions, because we're not just limited to the Houston area. It's Houston, Harris County, and the surrounding communities, okay? So there are millions of people who want to get their vaccines. Patience, patience, patience. And these are dedicated employees, staffers, volunteers who are giving up their Saturday and their days to make it possible.
I know Mayor, the health department said it wasn't able to reach everyone to tell them that their appointment was here instead of the Bayou Center. If those people, you know, go to the Bayou Center or miss their appointments, will they be accommodated, or will they just have to try to sign up again the next time appointments are up?
Sally, you want to take that?
Yes, we certainly understand that it's an inconvenience to have your appointment changed, and so sometimes that may not work for them, and sometimes we can't reach them, but we will certainly do everything possible to go ahead and accommodate them.
Should they just call the same phone number, or what should they do?
Yes, they should just call the same call center number.
Okay, great. And then just one last question for you, Mayor. Can you shed any insight on, you know, the supply coming in the next couple of weeks? I know there was some hope with the change in the administration's policy that, you know, more would be coming, and then there was some reporting that actually that stockpile had been exhausted at that point. So, any insight you've gotten from the state or from the feds about, you know, increases coming, you know, in the next couple of weeks?
I think that's probably the better question for Director Williams.
Yes, I saw the news. I'm not so sure how that's going to impact us, but week before last, we were designated as a high volume site, and so therefore the state sent us more vaccines. So we expect to get around 9,000 doses next week. 82 we're using ourselves. 800 we actually are sending out to Walgreens that are in high positivity zip codes.
All right. Thank you so much.
I'd like to,
Congresswoman.
I'd like to answer your question here. First of all, I said maybe I was giving too much information. I said that Houston is probably the major.
You want to lift your? You want to take?
Oh, my visor's on. Okay. Houston is probably a singular example of mega testing and as well early testing because of the connectedness of the City Health Department, the Advisory Committee, and being able to show you can do it, and therefore getting the higher number from the state of Texas. But the state of Texas is dependent on the federal government, which at this point we've determined that there's no stockpile. So we obviously need to push out more vaccines to be able to get them to the state of Texas and then to local jurisdictions. But the real point is that in your lifetime, my lifetime, my parents' lifetime, your parents' lifetime, I don't want to say your grandparents, because the last flu epidemic was 1918, but we had no cure. We had no vaccine. We have literally not seen this magnitude. Even with the vaccinations of the swine flu, which I saw, it was not at this level. The death rate wasn't this high. It didn't last that long. So there are people online and people sitting down and people in neighborhood have never seen and don't know how to react to the needs of massive vaccinations. Our system of vaccination is orderly. A mom takes her child from birth to 6 or 10 or whatever it is, as I can recall, and we orderly get vaccinations in a doctor's office. And as an adult, we rarely go back to get a vaccination. I get a lot of them because if you do international travel, you've got to get a whole series of vaccinations. But the normal adult is finished with their vaccinations as a child, depending on what era of time they were born in. That's what I think is unique and the media needs to focus on. This has never been done in the immediacy of our lifetime. And we're not finished. And so patience is of great importance, but I also think there needs to be a little bit of awe in what is going on. And when you have awe, then you're excited about being part of history. And hopefully we will get it right in the federal government so there's a stream of vaccinations coming to jurisdiction, and they're coming at a point where it's orderly, and that even if you are a low volume community or a high volume community, you will be able to get what you need. And so a place like Houston and the City Health Department, we appreciate the fact that they're good Samaritans, but the other communities, we have an obligation to make sure county this and county that gets the vaccinations. That is what the crucial issue is. It has never been done. We need to have a strong partnership so that it can be streamlined. And for the adults here, we know they've not had to take one with any real frequency as an adult. It's awesome, and it's going to get done. Let me also, I didn't mention, thank the Houston Fire Department and as well the Houston Police Department. But what we're dealing with, we've never dealt with, and so we're doing well, but we are fixing it as we are engaged in it. It is a real-time action of how to make it better. And the federal government should stand up and be a strong partner, and that's what I'm pushing for as well, with the funding and more vaccinations.
Sorry, I have the list of poll questions, so I'm helping them out.
A little bit louder, Mary.
Okay, go ahead. What?
A little bit louder.
Okay. So I have the list of poll questions. Some of this has already been covered, but we'll try to go through this quickly. The first one is, yesterday, President-elect Joe Biden called the current vaccine rollout a, quote, dismal failure to this point. Do you agree?
Well, it has not met anyone's expectations. Okay, so it has been very disappointing. It has been less than overwhelming. Let me put it that way. But there's an opportunity now to ramp up and get it and to do even better. I do think it would be helpful, for example, for many cities to have a direct distribution. I think that would help in the planning and getting it out. Because what makes it difficult is that when you don't know exactly what you're going to get and when you're going to get it, it's hard to plan effectively. So we represent that last mile, so a direct distribution would be better. Then at the same time, you know, we all need the resources to come forward. So I don't want to spend a whole lot of time on what hasn't happened. I just want to spend a lot of time on getting it out and getting it done. That's my attitude.
Mayor, the next poll question is, what's your message to Houston residents who are eligible for the vaccine, who want the vaccine, but due to the system failure still haven't received a shot?
Well, it's not due to system failure. That, I don't know whose question that is, but that's a bad premise to start with in the first place. It's not system failure. It's the fact that the demand far exceeds the supply. Even if every system was working perfectly, there's still not enough supply for the demand. And I think that's, let me just ask the media to help us out here, okay? Because facts are important. It's not the fact, even if you had every online system working perfectly, every call-in system was working perfectly, you are still going to have most people not able to get the vaccine because the supply is not available. You heard Director Williams say that up to this point, the city of Houston has received a little more than 30,000 doses. Now put that in context. There are 2.3 million people in the city of Houston. There are another 4 million people in the county. These doses are made available for not just people in the city of Houston, but people in the county and people in the surrounding region. There is not enough supply for the demand when everybody is wanting the vaccine right now. That's not system failure.
Thank you, Mayor, for that clarification. So as you are receiving more of the vaccine, how much notice will people get when? How much notice will people get when there are more vaccines available?
When you're talking about the second round? Mm-hmm. Director, you want to, how will people be notified of the second dose? You would automatically be notified. You'll automatically be notified for the second dose, okay? So when it's time for the second dose, you won't have to go online, you won't have to call. The City of Houston Health Department and the other providers will automatically notify you.
Thank you, Mayor. We're going to get the rest of the questions asked in just a second.
Is that system failure that y'all having a hard time getting those questions?
Yes, we are having a system failure right now with this cell phone. I apologize for that. No, I got it.
Excuse me.
I got it. Okay, here we go. Is this the next one? I asked those. Here we go, Mayor. Okay.
And let me just say this while you're getting that question together. Based on our timeline, as of 1 p.m., the goal was to do 2,500 as of 1 p.m. As of 1 p.m. today, 2,759 people have received their vaccines. So we are exceeding our own internal timeline. Okay. And let me just add this.
I have the next one. It's right
I want to thank the Health Department for an outstanding operation today. It's an efficient operation that's taking place today. And I'm not going to allow anybody to mischaracterize it, okay?
Understood. So, Mayor, the last question from the pool is, are there any security concerns at vaccine sites or other city properties or functions because of the national public unrest?
Well, with or without the national public unrest, we have our partnership, for example, with HPD and our law enforcement at all of our sites, especially at the mega sites. HPD and our police officers have played a very integral role. So, and especially at the super sites, when you're bringing in, let's say, 4,000 and 5,000 people in one day at one location, you just want to make sure that the premise is secure. Mm-hmm. And so we take that, that's a priority regardless. We're certainly much more alert to what's happening all around us, but security is a part of all of our super sites.
Okay. Now, I'm not going to count this as a system failure, but I do have another pool question for you. There is a video circulating that was apparently taken at Club Spire last night, and the question is about what is being done to enforce social distancing and stop events from getting too crowded. And do you have a message to business owners that are not enforcing the social distancing?
Well, I have a message for the state and for the governor not to allow these clubs and bars to operate and not to allow them to recharacterize themselves as restaurants. They're not restaurants. They're clubs and bars. That's what they do. That's their nature. Okay? That would solve that problem because if in the absence of this recharacterization, they're supposed to be closed. And if they're closed, you don't have to worry about social distancing. But again, resources are limited right now. When we are trying to protect key buildings and people in view of what's happening right now, where the country is right now, we don't have the personnel to be going into every business late at night to tell them to social distance. I would say to the business owners, to the business managers, you should be responsible. Okay, you should be responsible. But the definition of a club or a nightclub is to come together. I don't care how you characterize it. I don't care how you recharacterize it. If it's a club or a nightclub, you know, you are coming together. It's a social setting. And it also becomes a super spreader. Okay? So the best way to deal with that is not to allow clubs and bars to recharacterize themselves as restaurants and recognize they are who they are and they are not going to change.
Thank you.
Director Williams.
Certainly,
My
Director
question to
Williams.
you. I want to know what are the demographic information that you're getting from those who are applying for the vaccines. What are those data that actually shows that some people may be illegally in Houston, maybe from South America, and are they disadvantaged? Is your system picking them out? Is there a way that their information is being stored that frightens them? And the part B of the question now floats to the Congresswoman. Most of this job and work is going to have an opposition from the opposition party in the Congress. That's already said the 1.9 trillion is actually social money given to social services. Is there a way that reconciliation could be used to pick aspects of it to help this process? Or in the absence of what I just asked, when there's a failure, how much is Houston? How much are the residents going to stay and wait for vaccines?
Well, just to answer your first question, and if a person is living in Houston, from a health department standpoint, they're our responsibilities, and so therefore we're encouraging everybody that lives in Houston or Harris County to get a vaccine.
And to the